Please welcome Dr. Lauren Cheung, Head of Health Products at Apple, in conversation with Julia Manchester.
Dr. Cheung, it's great to be here, and thank you so much for joining us. I appreciate it.
Thank you so much for having me. It's really fun to be here.
I'm really excited for this conversation because I think oftentimes when I talk about wearable health with friends and family, the question I have is, how does it know if it's on your hand or your wrist, what have you? Obviously, the Apple Watch goes on your wrist and it's connected to your pulse, all of that. I won't get too in the weeds there, but I wanted to get your take on how is wearable health changing. I know that Apple has really dived into the hypertension space, for example, which is fascinating to me.
Yeah, there is so much going on in this space right now, and so it's a really exciting time to be here. When it comes to wearable health, I'll talk a little bit perhaps first about how we think about our mission in health. And what we're really here to do is to empower our users to live a better and a healthier day. And we do that by really making sure that we're democratizing access to important health insights. Ones that maybe you would traditionally only get in a clinical setting, but we're taking those clinically validated tests and bringing them to life in really fun, enjoyable ways where you can use them to really take care of your own health in a proactive and preventive way.
I understand that Apple talks about 3 principles that are crucial to Apple Health. I was wondering if you could go over those with us.
Yeah, so we like to say that there are 3 principles that are core to everything that we build in health. The first is that all of the data that we show to a user is actionable. So we spend a lot of time and energy really making sure that everything that we show a user is really grounded in something that they can take action on, whether it's an irregular rhythm notification that is allowing them to understand that they might actually have signs of atrial fibrillation, which can be which is an irregular rhythm that can actually lead to stroke, or whether it's an abnormal cycle pattern. And so they need to go and talk to a doctor maybe about that issue. And so we are really there to make sure that the information that we provide someone is actionable and, again, presented in delightful ways. The second core principle that we find truly important to everything that we build is that all of our features are grounded in science. That's why there's clinicians like myself that are really embedded within the design and engineering teams. We're there to not just make sure that we're grounded in science, but to really make sure that we're bringing in the best practices from medicine. So that means also bringing in a human touch to the way that we build our features so that we have that bedside manner that we're using that can make it feel a little bit less scary if you're getting a notification. And then the third principle that we build on is that everything that we do is grounded in privacy. So we start with privacy from the beginning that we build features. It is built into the core of everything that we do. So if you have your default settings enabled, all of your information is encrypted on device and also when it's backed up to the cloud. And so we can't access that information. We don't provide that information to anyone else. It's really your data, and it's your choice to do exactly what you want with your data.
On that issue of privacy, what are maybe some other ways that Apple, through wearable health, is protecting privacy? Obviously, you talked about how users choose how to handle that data, but how is the company protecting that privacy?
Yeah, so we truly do believe that privacy is a fundamental human right. And in order to protect that, if you have your default, if your device is locked with passcode, Touch ID, or Face ID, all of the information on device is encrypted while there. And if you are backing up to the cloud and using your default 2-factor authentication, then it is encrypted while in transit to and while stored on our server. So again, we can't access that information. But what is really important is that because we're building in right from the beginning, it actually means that we run our studies differently, and actually that we have to do many more studies than most people would, because we actually have to go out and collect consent to actually get your health information to be used for product development. And because of that, we're conducting research in novel ways. So in our research app, we actually allow people to choose exactly which data they want to share with researchers, which is something that's very unique to our study. And sometimes that means that we actually release some of our features a little bit slower than others might, because we are really dedicated to ensuring that privacy is built in right from the get-go.
I want to turn to women's health. Obviously, in conversations about wearable health, I understand that Apple, other tech companies are really zeroing in on this space. How is Apple looking to hone in on women's health?
It's been a large passion area of ours for quite some time. I think one of the things that makes what we do so impactful to those around us is that we're not afraid of the hard or even sometimes uncomfortable topics that are meaningful to health, and that's menstrual cycles as well as mental health. And so we were probably the first big tech company out there to actually, in a keynote, get out and describe and really kind of evangelize our menstrual cycle tracking features. And those menstrual cycle tracking features are there because the menstrual cycle is absolutely critical to a user's understanding of their health. And so we want them to be able to track that aspect of their health and also to get notifications when we notice an abnormal pattern arising in their cycle. And so we've spent a lot of time and effort to not just build features that can help users understand what is normal in their menstrual cycle, but also to advance the science. And that's where we, at the same time that we announced our cycle tracking features, announced a groundbreaking, large, longitudinal digital women's health study, which was one of the first of its kind. And that study is continuing to run. And we had numerous publications in partnership with the Harvard T.H. Chan School of Public Health to really advance the science of women's health.
I understand there's a lot of new health metrics that Apple now tracks. Which ones should a new user focus on as they're starting their wearable health journey?
Yeah. So there are so many to choose from, yes. I'll say. Now, we have features in 18 different areas of health and wellness. But what makes health so difficult to so many people is that health is largely invisible, right? So many people don't actually know if there's something abnormal going on or if they need to seek attention. In fact, we know that 60% of American adults actually only seek medical care when they are feeling ill. And so we've actually been building features for a long time to really change the way that our users interact with health, to make sure that they're getting the meaningful information they need so that they can take action in the moment. And we've been doing that, again, as mentioned, for years. But I want to highlight kind of two of our newest features that we're really excited about. So last year, we introduced end-to-end hearing health features that include an over-the-counter, medically regulated hearing aid as well as hearing test for the billion people out in the world that are actually suffering from hearing loss. And then this year, we've been really, really excited to announce our hypertension notifications. And if that's something that you don't have turned on, we absolutely recommend that you turn that on. So hypertension or high blood pressure is a disease that affects over 1 billion people in the world, and it is estimated that about half of those people don't even know that they have it. And that's important because hypertension is often called in the medical realm the silent killer. It's something that is completely asymptomatic, and so people don't know that they have it. But if it's left untreated, it often leads to stroke, to heart attacks, or even heart failure. And so now with hypertension notifications, you can wear your watch and get notified if you have signs of what we call stage 1 or stage 2 hypertension, so that you can then go have an informed conversation with your doctor on what the next steps are that you need to take.
How, with something like hypertension, which is so under the radar, forgive me for sounding naive, but how can it tell? I mean, what are the metrics that it's using?
Yeah, so the hypertension feature is built off of a variety of different sensors on the watch, but ultimately takes a look at the blood vessels and understands through the patterns that we are detecting and using AI. It tracks over the course of a month whether or not there are patterns that are similar to those of someone who might have hypertension.
Gotcha. We're sitting here in Washington, a lot of healthcare advocates or people who work in the healthcare space in this room right now. What actions are you most interested in seeing from Washington, from the Beltway, when it comes to digital health?
So digital health has just a tremendous ability to impact health broadly, not just healthcare, right? So when we think about healthcare, we often think about the direct interaction that you might be having with a doctor or the direct care that you're receiving from a doctor. But what we're building is actually building health. And so we're expanding someone's ability to take care of themselves. It's not just about when you're feeling ill, but really about trying to get ahead of it. And that's what we're doing with our everyday features, is really helping users understand what might be going on so they can have that informed conversation with physician earlier before they end up with the bad outcome. And so when it comes to what folks on the Hill can do, for us, it's really been about increasing access to these devices. We know that there's acts like the Wear It Act that have been proposed that allow users to actually use their HSA and FSA funds to purchase these types of devices so that they can actually use kind of the everyday features, but also really use all of the health features that are available on them as well.
What has the feedback been to a number of these health features? I mean, I know the majority of people I know have an Apple Watch or use Apple Health in some way, but what are some of the more popular, programs or metrics that users use, and what do you foresee becoming more popular?
That is such a hard question to answer. It has actually been a really fun journey for us. We have gotten what we call Dear Tim letters, where our users are writing in to Tim, kind of telling us about all of the things that they have found by using our features, and they've been really, truly inspiring. And so we've seen folks bring in abnormal heart rate trends to their physicians. We've seen folks bring in notifications from their regular rhythm notification to their physicians and getting diagnosed with that. I mean, every single feature that we've built, we've actually had some sort of notification or some sort of letter that's been sent to Tim, really kind of saying how much it's changed their life. But I'll point out one that has really been near and dear to my heart around mental health. And so a couple of years ago, we released one of our newest mental health features, which we call State of Mind. And we did that because mental health is as important to someone's health as physical health, but it's often underappreciated. It's something that is, unfortunately, rates of depression, anxiety are on the rise worldwide. And so we wanted to help users better understand their mental health. And so State of Mind allows people to log their moods and emotions, which by the science we know can actually improve emotional regulation, and through that can actually decrease symptoms of depression and anxiety. Alongside that, you can figure out and see what might be contributing to your mental health. And then lastly, it has a set of mental health assessments or questionnaires. These are the ones that you traditionally get in a doctor's office to evaluate for symptoms of depression or anxiety. Well, now they're available on your phone, and you can do them anytime, anywhere that you want. And so we actually had a user write in and say, right when we released this, that he went in, took the assessments, and found out they had a severe risk for anxiety and depression. And that prompted him to go to the doctor and have a conversation. He said, this is the best I've ever felt in 10 years. I knew that I had some anxiety, but I never knew how severe it was. And by being able to take that questionnaire on your device, I was actually able to get the help that I needed.
We only have a few minutes left, but what's one area where maybe Apple hasn't, of healthcare, where Apple hasn't explored, where you hope to get involved in? Is there a particular part of healthcare that you could see Apple maybe making more of a bigger presence in?
I think that right now we're at this incredible inflection point in health, and a super exciting one. And I won't say that we haven't explored it. I think we're really in the early innings of what we're doing in health, and that there is so many more opportunities to do even bigger and better things. And I'll leave it at that, because I do really think that there's just so many places that we can take it. And it's not just about what we're doing with our own health features. We've really been excited about how we're enabling third parties to actually use these health features as well, and that includes health systems. So we're seeing really delightful ways that health systems are integrating our features into the way that they care for patients.
Dr. Lauren Cheung, thank you so much for joining me here today. I appreciate it.